Complete Health Dentistry, transforming your health for a lifetime.
Good morning. You're listening to Complete Health with Dr. Mike Rogers. I'm Adam Owens, sitting in for April, the office manager at Complete Health Dentistry, and I'm here with Dr. Rogers today to discuss migraines and TMJ. Good morning, Dr. Rogers.
Good morning, Adam. How are you today?
I'm very good. I don't have a headache. I don't have a migraine.
Awesome.
There are some folks out there who do, and we'd like to talk about, well, them today.
You know what? And that's great. We'll talk quiet.
Oh, yeah, good idea. Good idea.
For those people.
So, Dr. Rogers, tell me a little bit about migraines, TMJ. What is TMJ? What does that stand for?
TMJ stands for temporomandibular joint. And what that is that's where the jaw joint meets the temporal bone of the skull. So it's that hinge there. And so that's the joint itself. TMJ that's that label. Tmj Disorder, or TMD, is the discomfort, the pain that arises because of improper joint articulation or movement.
And is that when you have that TMD, the temporal mandibular, and mandibular means jaw, something like that, right? Mm-hmm. So when you have an issue with that part of your body, does it manifest itself, right here and here, right just at these 2 points where the jaw hooks up to the skull, or can it affect you in other places as well?
It can. You know what? The American Medical Association actually calls TMJ or TMD disorder as the great imposter. And what they mean by that is there's so many things that can arise from problems with your joint. It can cause headaches, difficulty swallowing, difficulty chewing, difficulty digesting then, in essence. It can create pain in the shoulders, neck, tingling in the fingers. The pain can actually radiate down your back. So, there's multiple things. It can create neuralgias in the head, which can create numbness in the jaw.
And this is all from irritation or inflammation just around this little hinge. Well, it's not that little, I guess, but where your jaw connects to your skull. That just difficulty there can result in everything you just listed off. Yeah,
it can.
Wow.
And it just keeps going from there. It's a very unique joint to begin with.
Yeah, what makes that joint unique?
Because it's the only joint in the body that's both independent and dependent on the other side.
Independent and dependent.
Dependent.
Explain
exactly.
That.
And what I mean by that is each joint itself, to a certain extent, can move independently. So you can wiggle and jiggle your jaw joint, and your jawbone will go around. Your elbow, your knee is only going to rotate in one direction.
Kind of just does one thing.
Your shoulder can lift up and rotate as well. With this, our jaws rotate the first few millimeters, meaning as we start to open. But as we open more, it actually slides, or what we call translates. So it opens, and then it slides forward, and you can open big to bite that sandwich or that apple.
I'm over here kind of moving my jaw around when you're talking, and I can kick my lower jaw out. I can move it forward and backward and side to side, left and right, and of course I can open and close it. So a lot of different degrees and angles of motion here.
And this pain a lot of times can start as an infant, or not so much start as an infant, but the culprit that precipitates all of this can start when you're young. And what I mean by that is it can start from, growth and development issues when your bite isn't opening up as well as it should be, or your bite opens up too much early on in life, and that throws a disproportionate position of the joint itself. So it makes if your bite is off, you're going to increase the likelihood of TMJ problems in the future. I liken TMJ problems to us being Humpty Dumpty.
Okay, go
And
on.
what I mean by that is we've got this 10-pound bowling ball called a head, which is very fragile.
It's also kind of important.
Exactly. Sitting on a joint the size of the first vertebrae, which is about the size of a knuckle. And the only thing holding that together are all these muscles that are holding it in balance. And so if developmentally your jaw doesn't develop the right way, or your teeth don't develop the right way, and we're going to get into growth and development issues of the face in another episode, but if it doesn't develop right, things can be additive, meaning when you're young, your body can handle a lot of insults or more insults. So you slip and fall off the bicycle, off the swing. You have a four-wheeler accident, a little fender bender.
Yeah.
All of these things add up. And then what will routinely happen, it'll just be you stand up wrong or you twist or do something. And all of a sudden, now you've got these headaches, you've got these pains, you've got these numbness in your hands that weren't there before. It was just that little thing, the straw that broke the camel's back, so to speak, that just pushed your body over that breaking point or tipping point. And now you've got TMJ problems. They were always there before, but it was just that one little thing that pushed you over the edge. And then it's going back all the way back to the beginning to figure out how do we effectively treat your airway issues that may have precipitated this starting back at childhood.
So when you have a TMJ disorder, what's actually going on in there? Is it an inflammation issue? Is it I don't know, I'm not saying the right thing, I'm sure, but like a lack of lubrication inside the joint? What's really
there's
happening?
A bunch of things. There's both inside the joint issues that can be a problem, and then there's extra joint or outside the joint issues, usually muscle. And then it could be a combination of the two. So there's a whole bunch of things. The whole part here is a lot of it, especially headache issues, are derived from the muscle issues. So if the pain itself usually isn't the joint, the pain is the muscles, the pain is the headache, the pain is the all this other ancillary stuff. It's not so much the joint. The popping and the clicking are the parts inside the joint that we hear pop and click as you open and close.
So is that kind of a classic sign of a TMJ disorder?
It's usually the one thing that people say, oh, I got TMJ because my jaw pops and clicks.
Does a pop and click always mean TMJ?
That means there's a derangement or something in the joint. There's a problem in the joint. You may not have the symptoms, the tingling in your fingers, the headaches, the difficulty swallowing, the insomnia, all of these things that we're describing today, the headaches. But it's something that you're always at that threshold like Humpty Dumpty, that one little push. And now you're an omelet.
Or scrambled eggs.
Something
like that. Okay, well, we're talking with Dr. Mike Rogers from Complete Health Dentistry. The show is called Complete Health. We're discussing your entire body's health. And today on the program, we're discussing migraines and TMJ. Now, we're gonna take a break in just a moment, but I want to ask you, Dr. Rogers, about the association between TMJ and migraine.
Okay. As we were just talking about, Adam, a lot of the migraines, a lot of the headaches itself, because this is actually heading into Migraine Awareness Week, but part of it is it's muscular. As your muscles fatigue, because there's a lot of little muscles here in the head and neck, as they fatigue, it decreases blood flow, which now you can build up. I liken it there too to having a Charlie horse in your calf or your ankle. Your muscles are Charlie horsed, and that once again comes back from growth and development. Your vertical height or your bite distance or the length of the muscles there aren't where they should be because you didn't develop the correct height. That increases the crowding issue, which increases the potential for TMJ. But where we go from there is as the muscles fatigue in Charlie horse, blood flow can't get to it. So now you've got lactic acid buildup. You've got these other problems here, and that's what creates the headache. That muscular pain is what's creating the headache. The tension in your muscles is what's creating the headache. All this, in essence, are a lot of us, most of us are all, in essence, Charlie horsed. And I'll have patients say to me, well, doctor, I don't feel that tension. I don't feel that pain, but it shows up as clenching and grinding. It shows up as wear and tear and breaking of teeth. It shows up as a whole bunch of other things. It's just we've grown accustomed to it because it started when we were young, 2, 3, 4, 5, 6, and we've grown through all these years with it. And so it didn't, the initial incident right now or this current incident is what tipped you over the edge, but it's all the things that led up to this through the years that have been pointing towards this problem coming in.
We're talking with Dr. Mike Rogers here on Complete Health. When we come back, we will be discussing some of the specific causes and symptoms of TMJ.
Are you suffering from recurrent headaches? Are your teeth worn down? Do you have constant jaw pain and soreness in your shoulders or neck? These and a host of other symptoms could indicate a TMJ issue. If you are tired of living with pain, call a doctor you can trust, one with extensive training treating TMJ. Call Dr. Michael Rogers at Complete Health Dentistry of Northeastern Pennsylvania. The gentle, capable hands of Dr. Rogers, along with the most cutting-edge diagnostic equipment, can soothe away any imbalances that may be causing your distress. Let Dr. Rogers restore your teeth and use the natural placement of muscles in your head and neck to relax your jaw into its most comfortable, balanced position. Get relief today. Call 253-5000 and schedule your new patient experience.
Complete Health Dentistry, transforming your health for a lifetime.
Visit us on the web at CompleteHealthDentistryofNEPA.com.
Welcome back. You're listening to Complete Health with Dr. Mike Rogers. Today on the show, we're discussing migraine headaches and TMJ. Dr. Rogers, good morning.
Good morning, Adam.
Dr. Rogers, before the break, we kind of went over really what TMJ is. It's this issue with temporal mandibular
Joint.
Okay, and this is the joint where your jaw hooks up to your skull.
Correct.
And that joint is a pretty cool joint because it can move in all kinds of directions.
Right.
And it also bears quite a burden as you chew.
Right.
I'm just
and in
guessing
my
here.
case, it bears the burden of letting words come out too.
A little hot air sometimes. No, I'm kidding. I'm kidding. So, Dr. Rogers, can you discuss with our listeners some of the causes of TMJ?
There's multiple causes that can do it. Trauma can cause it. Once again, growth and development, which cause malaligned teeth, and then malaligned teeth can predispose us or kind of point us in the direction of having joint problems and function problems. Osteoarthritis or bone issues can predispose us to it. There's a whole muscle issues. You get strains from muscle back pain. That old thing, the head bone's connected to the neck bone's connected to the backbone's connected to the hip bones, leg bones, and so on. So you can have an issue from the TMJ or the jaw that twists and torques your muscles up here and creates a ripple effect through your muscles throughout your body and can create the way you walk and move because of just one little muscle up here in your jaw joint.
It's all connected.
Because it is. And as each little muscle is irritated or inflamed, there's a bigger muscle on the other side that's trying to balance it. Because we want to, our visual cue is being level. Mm-hmm. And so if our head is cocked or twisted, we're not seeing the world in the proper way, so our body's trying to balance this all out,
or compensate for it. So, sorry to interrupt you, but the jaw wants to both sides of your teeth want to strike at the same time.
For the most part, exactly. And that's the thing. It's also a three-dimensional issue. So, for example, if you're flying a plane, there's 6 dimensions of plane flight. There's forward, there's back. Well, you can't really fly backwards, but it's called yaw and rotation and pitch elevation, pitch, and all of that. And our jaw does all of that. So if you're missing a tooth and it throws your bite off on one side, your jaw is going to twist or torque to that way. If you're missing teeth way in the back, your jaw is going to rotate up and back. And that's going to put extra stress on the joint itself because your muscles are pulling tighter and tighter, almost like elastic bands, pulling this tighter and actually causing more pressure, which then if you even just take your fingers and push lightly where your jaw comes right up into your ear, once you just put a little pressure there, your hearing changes. So it can increase the likelihood of tinnitus. I know I'm going back and forth, which is ringing in the ears and difficulty hearing and things like that. So just this little change from losing a tooth could create a problem in the future in hearing and chewing and function and balance.
For car guys, it's almost like it's an alignment issue.
Exactly. Your front end's out of whack. And that's really what it is if the jaw joint's out of whack because there's a problem with crowding or an airway issue. I keep going back to airway because that is a big issue here that drives the whole aspect or a lot of this. I wouldn't say the whole thing. What can be some of the symptoms as we talked about? Headaches. Headaches a big one. I get a lot of patients in my office that will come to me for headaches. Muscle pain and muscle fatigue. Tingling in their fingers.
Can I ask, the muscle pain, the muscle fatigue, is that just around the jaw area?
No, you can get muscle pain, muscle fatigue in the face and neck, shoulder, neck, and back pain and fatigue. A lot of that, once again, can also be due to airway issues, which can contribute to all of this in growth and development.
So let's talk about some more of the symptoms. You said tingling, really?
Tingling, like a numbness in your fingers.
Like
in your
all
hands.
day, every day, or comes and goes?
It can come and go. It can be all day, every day.
Wow.
And once again, that goes hand in hand with that head alignment issue and how your head, your skull, and your spinal cord your spinal cord comes out of your skull because you just put that little kink like in a garden hose. If you just put a little kink in that garden hose, the water's not going to flow properly.
Right.
And that's the same thing here. And that's what can create this tingling in your finger. And that's why I was saying you can get, I call it a descending problem, meaning you can get a problem here with that little kink in the garden hose called the spinal cord. And it could create a problem that runs all the way down your back and can create lower back issues as well. So there's so many things.
Wow.
Insomnia can be a part of TMJ as well. Difficulty swallowing, difficulty breathing, difficulty just in function itself.
And I'm kind of hearing, if you have difficulty breathing, if you have difficulty swallowing, other problems will come up as a result of, if you're not chewing your food right, or if you're not breathing right at night, you won't sleep well. And if you're not sleeping well, other things could go wrong. It's like a cascade effect almost. It is. That's a perfect term for it. It is a true cascade, and that's why the AMA calls it the great imposter. So it's a multidisciplinary treatment modality, meaning we need to all be cognizant or understanding that you've got all these symptoms, and if traditional medicine it can't get to the root of it, meaning if there is no medical reason for the pain, the fatigue, and the discomfort, you've ruled out any types of cancers and any types of autoimmune or bone issues that medically need to be treated. Well, then let's seriously look at TMJ because it can create any of these symptoms as well. I think I see what you're saying. So it's sort of like if I'm getting like frequent headaches and I am just taking headache medicine all the time, but the headaches aren't going away, but I'm just kind of masking the pain with something over the counter or maybe something prescription strength, but the underlying cause is a TMJ issue. Unless we address that TMJ issue, those headaches they're just going to keep coming back, and I'm going to be sucking down medication for the rest of my life.
Correct.
Uh-huh.
Correct.
Well, you are listening to Complete Health with Dr. Mike Rogers. Today, we're discussing TMJ and migraine issues. We're going to take a quick break, and when we come back, we're going to talk about some of the common treatments available to treat TMJ disorders, and we're also going to talk about specifically what Dr. Rogers does in his office to help people experiencing TMJ issues. Stick around.
If the snap, crackle, and pop you're hearing at breakfast is coming from your jaw and not your cereal bowl, chances are you've got problems with your bite. It could be out of alignment. This uncomfortable jaw position may cause frequent headaches, soreness in your face and jaw, numbness in your fingers, and a variety of other symptoms. Sound familiar? Well, you're not alone. In fact, 70 to 80% of the population suffers from these symptoms. The good news? There is a solution. It's called neuromuscular dentistry, available at Complete Health Dentistry in Honesdale. Dr. Michael Rogers will determine the most comfortable position for your bite, then gently reposition it with an orthotic or dental restoration. You deserve to live with a pain-free smile. For more information on neuromuscular dentistry or to schedule a consultation with Dr. Rogers, call 253-5000.
Complete Health Dentistry, transforming your health for a life.
Visit us on the web at CompleteHealthDentistryOfNEPA.com.
Welcome back to Complete Health with Dr. Mike Rogers. My name is Adam, sitting in for April today, and I'm joined in the studio by Dr. Rogers. Good morning.
Good morning, Adam.
We're talking about TMJ this morning. We've discussed what it is, what causes it, and what some of the symptoms are. So next up, what if I have a TMJ disorder? What do I do? Who do I go see? What treatments are available for me?
A great question. What it is, Adam, first off, most people have already seen a physician for this. because they're either having headaches, they're having chronic pain, they're having some other symptom. As we've already mentioned a couple times, it's the great imposter. Yeah. So they're on medications. If you're tired of being on medications for the headaches, the pain, and things like that, and you've ruled out any brain issues, cancer issues, and all of that is taken into account, because we need to look and make sure there is no underlying major systemic issue or major cause for this. So we want that ruled out, and we need the help of our medical practitioners to rule all of that out. So once that's ruled out and you're like, I'm tired of being medicated or taking medications, or I can't live like this because my headaches come constantly, then we get you in the office and we evaluate you with a full battery of photos, exams, and x-rays. And then we determine, do you have TMJ and don't you? What ultimately is the root cause of it, meaning what drove this way? And a lot of times we go back all the way to when you were a kid discussing it, all those additive points that come up to it. What treatments that can be used by most dentists will be either a soft night guard. And for some people, that's all they do. They can get into a soft night guard. It can relax the muscles while they're sleeping. Once again, if you're clenching and grinding when you're sleeping, that could be a symptom of sleep apnea or other sleep disordered breathing issues. Once again, we're going to get that in a future discussion. But so there's underlying causes why you're clenching and grinding at night that we could certainly look into.
The night guard kind of looks like an athletic mouth guard.
Exactly. It's soft and rubbery, flexible.
And you just put it in and you sleep with it. You don't walk around all day with it, though.
No, no. Because one, you're going to chew through it if you walk through it or try to function with it. The other that some dentists will use is what's called a splint. It's a hard appliance that sits on your teeth, and it separates your teeth to give you some space if there's a space issue. And what I mean by a space issue is your bite is overclosed. You're biting too deep. Then we need to open the bite up, and that some doctors will use a splint. In my office, what I do is what's called neuromuscular dentistry. And as you've heard me talk, TMJ problems can be caused or create issues because it can create electrical problems in our spinal cord and all the nerves in our face. And that's the neuro part. Mm-hmm. The muscular issue is all the muscles of the head and neck that hold this bowling ball, as I said, on the knuckle or the joint of the vertebrae. And so that's the muscular aspect. So neuromuscular dentistry is when I relax out the muscles using what's called an ultra-low frequency TENS, relaxes out the muscles so that the muscle is in the proper length for you. And what I mean by that is our bodies are designed. We're genetically designed to have balanced lengths of muscles. Mm-hmm. Our right calf is the same length as our left calf. Our right, bicep is the same as the left. But what happens is if we have an imbalance in our bite and our muscles get shorter because of an imbalanced bite, lost teeth, broken teeth, growth and development issues. These muscles, in essence, are Charlie horsed. They're shorter than they should be. So what using this ultra-low frequency TENS does is it relaxes the muscles to their proper length.
Got it.
And then once we've got the muscles at the proper length, we create what's called an orthotic.
Okay.
It's a bite appliance that you you put it in the mouth, and we do all our adjustments and figuring and fine tuning on this acrylic bite appliance, so that we eliminate headaches, tingling in your fingers, shoulder, neck, and back pain, insomnia, all these other things that we're trying to work our way out of.
It's sort of like an alignment blank. Once you've got this thing in, does it kind of force you into the proper position? It
doesn't force you into the proper position. It brings your muscles to the proper position. And what it is a lot of it, depending on the person or the patient itself, we need to use multi-medical modalities in a lot of times getting in. What I mean by that is I've I can correct the bite, and I can tell the patients exercises and things to do to eliminate some of the pain in the muscles through the years of experience. But a lot of times I'm sending patients to physical therapists because they can speed the healing of the muscles and strengthen the muscles that have been weakened for years. I'll send them to chiropractors because they can do the same thing with helping align where the skull meets the vertebrae and the vertebrae themselves. A lot of this too is as it creates this ripple effect. You know, we want proper posture. We want proper, sit up straight, stand straight, shoulders back, more like a soldier. But people today don't look at it that way. You know, I always joke, when I was a kid, my mom would smack you and go, sit up straight, and that's the thing. We don't sit up straight. A lot of us are hunched over our computers.
I bet you about 25, 30 people listening now just sat up a little straighter hearing you say that.
And so once again, it does affect the whole body. And so we need a joint effort to unravel quite a few patients like this. So the orthotic is what I use. But yes, when I'm taking how I take my bite, meaning how I get the bite and the jaw related, I'm having the patient sit up as straight as they possibly can in the chair, and then I'm reiterating every time we see each other, good posture, good posture, good posture, sit up straight, and things
What's
like that.
the difference? You fit your patients with orthotics, and you're saying a little earlier that sometimes patients are fitted with splints. They sound fairly similar.
Yep.
What's the difference between the two?
The difference is, and they may even look very similar, the difference is how they're manufactured or made and how we do that to make it. For example, with a splint, we're not relaxing out the muscles. We're just putting some goo in the mouth, having a patient bite into it. That shows us how our top teeth and our bottom teeth meet. We'll send that to a lab. The lab will ask us, how thick do we want this appliance? And so what we'll say, okay, 2 millimeters, 3 millimeters, 4 millimeters, whatever it might be. And they'll make this appliance 3 or 4 millimeters, usually in the front. So it's almost like a wedge shape.
So front thickest, and then it thins out towards the back of the mouth.
Most times. All right. And so what happens is it opens the bite in the front a little bit, but it creates this wedge shape. It's not actually taking into account where our muscles should be.
So it's a little less precise. Would that be safe to say?
Yes.
Okay.
With an orthotic.
That's the splint. So the orthotic.
With the orthotic, we're relaxing out the muscles. So as the muscles relax, your jaw will drop down to where it's supposed to be, because the muscles are what's holding it there. As your jaw drops down to where it should be, that's where we take the bite relationship. So now it's level all the way. It takes out all those tips and torques because your muscle is the sling holding it there, and it balances things out, and from there we use it. The other thing is, it's like a splint for a leg. You still function, but you're functioning with a limp. With an orthotic in your shoe, you're functioning on it all the time and going from there.
Once a patient comes into Complete Health Dentistry and is treated for TMJ issues, and you work with them to the point where the symptoms are gone. So, the headaches are gone, the breathing issues are gone. Are they free and clear? What's next? Well,
the thing is, this is just transitional or temporary, meaning we'll take this because it is a piece of acrylic. It will break down over time, and so the symptoms can come back. So to permanently eliminate it, we can do orthodontics, restorative, meaning fix the broken teeth and build up the bite, or a combination thereof. And so what it is more and more my patients that don't need restorative, even my more mature patients, such as myself, can open the bite up using adult orthodontics and techniques that we know on lifting teeth up to get us in the bite position. One other thing, if you're frustrated with just having pain, and you just can't seem to kick it, give us a call. We'll get you in. We'll look at everything. We'll sit down. You and I will sit down and figure what's going on. Give me a call, 253-5000. I look forward to helping you or one of your family members.
Dr. Rogers, thanks for talking with us today.
Thanks, Adam.
Complete